Hey everyone, I'm your host Adrian. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Welcome everybody to today's live class presented by the all-new Rupa University, the best way to learn about specialty lab work from industry experts. My name, as always, is Adrian Martinez, and I will be your host for this afternoon. As May is Lyme Disease Awareness Month, today we have a very, very special guest in Dr. Jakel Patterson, here to chat Lyme 101, a clinical and laboratory review of infections and beyond. Before jumping in, a couple of quick housekeeping items. Everyone joining will be muted by default, but don't fret. If you do have any questions, please use the Q&A button at the bottom of your menu bar, and we will host a live Q&A session at the end of the presentation. In the end of this presentation with that Q&A, we have a very special guest in Dr. Barascano, medical advisor for Mygenic, who's going to hop in and help give us a little bit of insight specifically on the tests that we'll be chatting about today. Immediately following the Q&A, yours truly will show you exactly how to order these tests on Rupa Health. And then from there, if you are a fan of this type of content, please be sure to check out rupahealth.com or rupauniversity.com to get access to all the previous recordings that we've done. And finally, if you do have to jump early, no worries, we are recording this session, so you'll be able to get a review of it and check that out on rupahealth.com after the presentation. So with that, let's go ahead and jump in. I'd like to introduce Dr. Jakel Patterson. Dr. Patterson is a nationally recognized naturopathic physician, success coach, best-selling author, and Forbes contributor. She owns a successful multidisciplinary medical practice in Fairfield, Connecticut. She has over 13 years of clinical experience with a focus on Lyme disease, autoimmune conditions, anxiety, depression, and childhood developmental disorders. Dr. Patterson, thank you so much for joining us this afternoon. I'll go ahead and let you take it from here.
Okay, I first have to unmute myself. So hi, everybody. Thank you, Adrian, so much for the introduction. Thank you all for being here, either good morning or good afternoon for you. For me, I am in Connecticut, so it is good afternoon. And I am so happy to be presenting today for Rupa Health. And I will go into, the presentation will be Lyme Disease 101, Beyond, and Infections. And if I have enough time, I will definitely plan on going through some recommendations by way of integrated treatment plans, but we do have a lot to go over in the 45 minutes of time. So please hold your seats tight. But I definitely wanted to go into infections too, as it relates to autoimmune conditions, demographics, some different information that you may or may not hear traditionally about Lyme disease. And I know that the group that'll be listening today have a wide array of background and information or knowledge of Lyme disease. So we will go through a broad overview and then dive deeper for those who are at more of an advanced level. So as Adrian said, I will also be bringing in Dr. Barascano, who will be joining us, who was a past president actually of ILADS, also one of the medical advisors for Mygenic. So he will be here at the end, especially for Q&A session in case there are particular questions as it pertains to some of the testing. So I will share my screen now. Okay, so as Adrian said, my name is Dr. Jakel Patterson, been practicing for about 13 years out of Connecticut. And obviously we know Lyme was founded in Connecticut, although it is everywhere throughout the country. Best-selling author, Forbes contributor, also keynote speaker, and also is the past president of the National Association, the American Association of Naturopathic Physicians, and also member of IFM, so pretty active by way of the profession. So I always like to go through, what is my story, my experience. I myself had Lyme disease, Babesia, as well as Bartonella. Took a long time before that diagnosis was found, and that actually really happened while I was in my naturopathic program in the last couple of years, which they thought was a spider bite. Also, we're ruling out autoimmune conditions because I have a family history of autoimmune conditions by way of lupus and rheumatoid arthritis. So some of the symptoms that I had at the time were chronic fatigue, random and migratory joint pain, which is very, very indicative of Lyme disease. Oftentimes it's migratory joint pain where one week my knees would be swollen or my legs would hurt. And then like that, a minute, an hours later, it would be gone. And the next day I would have pain in a different area of the body. I also had a lot of profuse sweating, almost like night flashes, like you would get perimenopausal. I would have insomnia, anxiety, which they often just ruled out as anxiety. But what happened was those symptoms I never had before. And also they occurred in times that I was not under stress. And so later found out as I started treating patients, I'm like, wait, this sounds very much like myself. And actually got tested and found that I had those very same tick-borne illnesses that my patients actually suffered from. So what are we going to go over today? We're going to go through origins of Lyme disease, laboratory diagnosis, other tick-borne infections. I won't go through all of them, but at least some of the primary ones that you'll often see for patients, other infections and considerations, demographic considerations as well. And then if we do have enough time, I will be able to go into treatment and prevention. Okay, so have you ever wondered, so one of the things, that's my dog in the background, this is Zoom. Have you ever wondered, one of the things with Lyme disease is that the rates of infection have increased much higher than what is actually reported in CDC. And so we're seeing this increasing number over time of technically about 30,000 individuals are diagnosed each year, but the CDC estimates that number is at least 10 times higher than what is reported. I see patients throughout the country, oftentimes some of them in New York City, and they're always surprised to find out because they're in the city. We don't have, grass. We don't have, why would we have ticks? But they have decided, some of their symptoms are not adding up and we'll have that diagnosis. So we are seeing it rise. And I think the last number I saw was about 400,000 plus individuals suspected, because not everybody, again, is knowledgeable that they have it or is necessarily reported as a diagnosis. So Lyme population has doubled. So it's doubled since 1991. Typical transmissions, 36 to 48 hours. However, they're not 100% sure. It could be potentially less than that. It could be anywhere between, I know with the Powassan, they had just said virus showing is as fast as 4 hours. And so you're going to see it up to 4 to 12 hours. But generally it's on for a period of time, but it definitely can be shorter period of time than that. So for those who do not know, it was discovered in 1975, where children in Lyme, Connecticut were actually getting diagnosed a big patch of juvenile arthritis. And what they started doing, a rheumatologist at Yale began treating with antibiotics and they became well, which doesn't match with a person who was diagnosed with arthritis. And so what they did was the samples were then sent out to Willy Burgdorfer, who actually was also the person that discovered Rocky Mountain spotted fever, something that I often see in the office, even though people will think it's not something you would see on the East Coast, but I definitely have picked that up in clinical treatment and lab work. And so what he did was he found a spirochete and test later named it obviously after himself. So other diseases that mimics, one of the things that I'm often looking at with my patients is also doing often an autoimmune panel. So some of the patients that we have will often have other comorbidities. They have rheumatoid arthritis, which will often flare or get worse with Lyme disease. MS, multiple sclerosis, very much mimics it. I know, in fact, one of my patients had an MRI done before she had seen me in New York City, and she had plaques, which Lyme can also show plaques. And they were actually suspecting the diagnosis of MS. After 6 months of treatment, the plaques actually cleared. They did a second MRI 6 months later, that cleared. And obviously the neurologist was interested at that time of what she was on to actually help to support that. Also, obviously all her symptoms also dissipated. Fibromyalgia, which, as we know, is often a diagnosis of exclusion after other things have been ruled out. Chronic fatigue syndrome, as well as ALS, which I've often also seen in the office. So transmission primarily from the Ixodes family. We have scapularis on East Coast and Pacificus on the West Coast. It can be found in the body for many, many months. especially if it's in the round body form. You will see it for a longer period of time. It's known as the great imitator for a reason, because it mimics many different conditions and is one of the reasons why it takes time to diagnose. One thing is, it is possible to get diagnosed any time of the year. Oftentimes people are thinking it is very specific to a certain time of season. It is higher May to July. As we know, this month is Lyme Awareness Month. And the reason is that there's more reproduction in the spring. So it's more likely. However, I do get diagnosis of Lyme disease year round throughout the year. So there are 4 main species. So we have Borrelia burgdorferi, as well as Borrelia miyamotoi, which is the most common in the United States. But there are different strains. And the reason I'm mentioning that is sometimes I am checking for those different ones, especially when folks are traveling a lot or if they're from different countries. So when we look at the other types, Borrelia afzelii, Borrelia garinei is most common in Europe and in Asia. So you will have some embedded slides. I apologize for the numbers being smaller, and I think it also changed a little bit for some of them with the font, but I will make sure that that updated PowerPoint deck is given to you guys all. So these are slides that are embedded with Igenics, because I will be talking about some Igenics pieces that they actually provided for. So I thought that the schematic was great because it shows that distribution by Tick-Borne throughout the country. As you could see, Lyme disease on the left is way more rampant than the others, but there's different pockets by area. But the part of the illustration I wanted to show is that it really is throughout the country, because a lot of times folks are thinking it's only in the Northeast, or I've heard that from many of my patients, like, oh, it doesn't exist in California. As you can see, all the green pockets in California, or in certain areas, or in Texas, or et cetera, because I get people again from everywhere, but it does. And it's, so the reason I'm saying that is it's important wherever you are throughout the country to be checking if some of these symptoms aren't adding up. So again, known as the great imitator, Lyme disease and co-infections are spreading nationwide, present in all states. One of the reasons for the rise, as well with other just diseases, infections, is travel. You know, that was something about the rise of many things, is that we're getting closer to each other and people are traveling a lot more than they have before, which allows for things to get spread from state to state. And obviously the tick population as well is growing. So what are some of the early signs? So some of the early signs are bullseye rashes, and bullseye rashes about close to 50%, but actually even some of the studies I've seen has been even less than that, about 40%, by way of tick-borne infections, or I'm sorry, bullseye rashes that have been seen. And it can mimic a spider bite. I have seen that where patients look like it's a spider bite, but in fact it is actually a tick. And so that is one thing, and the reason I want to mention that is that is something that I often will hear patients tell me. Their doctors say, well, you don't have a bullseye, so you can't have Lyme disease. And that actually is not true. So that is important to know, that many, maybe over half, do not actually have a bullseye rash. Initially, oftentimes some of the symptoms will be muscle pain, body aches, fatigue, headaches, swollen lymph nodes, Bell's palsy. I've seen that for some of the patients, racing heart, brain fog. And so brain fog might be confused, especially if a woman is perimenopausal, and is the brain fog because of that. And so oftentimes I'll say, when I see patients, I'll see the symptoms that get best first are oftentimes more those physical symptoms of physical, body pain, muscle pain, joint pain, headaches, and also things like more and fatigue, typically first, before I see more the neurological symptoms improve, because again, they're on like a deeper level, higher stage, versus those early signs that often come up. So what does a bullseye rash look like? Takes from 3 days to 30 days to show. It can take up to 30 days to show, but most are typically within 7 days, and it could spread as much as 12 inches. It is typically warm and not itchy. That's good to know. And it could occur really in any part of the body. So greater stages, we have, you'll see for somebody blurred vision. I'll have people with issues with what they call ocular convergence, issues focusing, blurriness, sensory issues like light sensitivity, hearing sensitivity, ringing in the ears. I've seen seizures. I've seen seizures actually while I've been doing video and telemedicine consults, crazy as it is for some of my patients. A lot of eye pain. Some symptoms might only be 1 or 2 of these. They don't have to be all of them. Numbness, tremors, encephalitis for some, as well as chronic Lyme arthritis. That is one lingering thing that I will see for some patients that have suffered from Lyme disease for a long period of time. So other tick-borne infections you want to consider, there are many, but I want to talk about the primary ones. So Bartonella is one, also known as cat scratch fever, that can be transmitted from cats and ticks and other forms they are showing. But the rash will appear like a stretch mark, but it'll literally look like a scratch. And one way to kind of spot it is that in comparison to other stretch marks, is stretch marks will usually go by way of like if you're gaining weight, or if you are growing. So it might be horizontal, or it might be if you're growing, vertical. And so if they kind of do not match that, or they're on the back, but they're across the back, or they're not really going with the normal either growth or weight gain, that is a little bit suspicious of what's going on. The cool thing is those you will actually sometimes see in treatment, those stretch marks, those scratches, actually those marks dissipate as they actually improve in their symptoms. So definitely look for that as a physical sign. Not everybody has those, that specific rash. I myself had Bartonella and I didn't actually not have those marks. So not everybody does, but it is a good tip off for that. Symptoms like fatigue, neurological symptoms, oftentimes having more neuro issues, headaches, joint muscle pain, insomnia, as well as swollen lymph nodes, which you also will see with Lyme disease. And oftentimes with Bartonella and Babesia, I'll have to see that there might be testing 1 or 2 times before, or maybe even more than that, or it may not actually even show up for a period of time before it shows positive. And so remember, the diagnosis for like Lyme disease, even per CDC, is a clinical diagnosis. The labs are really important, however, to confirm. However, it still is clinical diagnosis, and you may still support and treat someone based on the symptoms that they're presenting with that are in line with the tick-borne infection. So Babesia, we have Babesia microti, Babesia decani, very similar to malaria. It is transmitted through a tick bite, blood transfusion, which is, they say, a blood parasite. Sometimes profuse sweating, which I mentioned I had profuse sweating, which was told I was just an anxious person. Chest pain, shortness of breath. We'll have like what's called like air hunger, which I also see with people with walking pneumonia, mycoplasma. Changes like undulating fever, that can also happen with Lyme disease, where they'll say they feel like kind of feverish, which will go away. And in more significant cases, it can actually cause hemolytic anemia as well. And also, if untreated over time, can cause low blood pressure as well as liver failure. Anaplasma, Ehrlichia present similarly. Symptoms are also comparable to Lyme and also can cause a lowering of the white blood cell count. So I wanted to mention some other infections I'm often checking. And the reason I check is that sometimes these actually will go up. These numbers will increase up, or somebody will go from EBV early antigen instead of the regular, IgG, because again, we know about 85% of the population has had EBV from childhood as a teen or a young adult. But what I'm looking for is it reactivated. So one of the ways to check for that is looking at the EBV in terms of IgM, as well as early antigen, which is often not checked, to see if that is reactivated, especially when they get Lyme disease, or if someone gets a cold or sick, et cetera, and their Lyme symptoms are creeping up. EBV is one that I'll look for. And EBV has definitely been checked as one of the prime infections connected with in terms of many different autoimmune conditions, which I will go through as well. So some of the symptoms: fatigue, swollen lymph nodes. I'm often checking for lymph nodes on the neck, enlarged spleen, transmitted through bodily fluids, and also can obviously spread from one person to the other. I did want to mention this here in terms of strep, because we do at our office see a lot of kids with PANS and PANDAS, and PANS and PANDAS will often, you'll see with Lyme disease as well. And so strep is another one you might want to check in terms of anti-streptolysin antibodies, ASO, or if someone is a carrier, which is often commonly seen with kids. So you're going to check for, frequency of infection, if they're getting sick often, if obviously lymph nodes, sore throat, a kid that is, the parent says they're always getting a cold, they're always getting strep infections, have a history of ear infections, things like that frequently, you do want to check strep antibodies. And if there's behavioral mood changes, those are also things we're checking. I've even checked for adults who were positive if they said that they had a history of that as a child, so I can get a better idea of just overall their immune function. Other tests you want to check in for, walking pneumonia is a common symptom because some of the symptoms are fatigue, air hunger, respiratory infections. Someone like myself who has asthma, it can play a role in asthma and be found in months, for months after acute pneumonia. So mycoplasma is considered a persister infection and will often sometimes stay positive even longer than you will see for Lyme disease. So I wanted to kind of discuss something a little bit different here in terms of demographic differences. So there are demographic differences too when you have someone that has Lyme disease. So women, people of color, African Americans, they may present differently with Lyme disease. So one thing, for example, the dermatological presentation can appear differently on darker skin. My father, I'm mixed, I'm half Black, half Chinese. My father is darker complexion. He actually got Lyme disease and they thought it was a spider bite. He sent me the picture. He went to the ER. He had fever, all the classic fever that wouldn't go away, significant pain. He was in his 70s, energy, just sleeping all the time. He went initially, they thought it was a spider bite. And then a month later, he tells me, hey, Jakel, I feel like, I don't know, maybe age is catching up to me. And my dad is a person that does tons of things outside on the 6 acres of land, extremely active, physically active. He said, you know, maybe it's my time, you know, like I'm now no longer could be operating like somebody in the 40s. Now it's hitting me. I'm tired, I'm joint pain, et cetera. So I asked, what had happened and what had happened after he went to the emergency room or the doctor a month later. He was still having the symptoms. So I check and they send me a picture and I'm like, wait, this looks like a tick-borne, looks like a tick, not bite, more so than a spider bite. So he was getting blood work, following up with his doctor. I told him to add Lyme disease in Quest, and it showed clearly positive IgM. He got placed on antibiotics. He was an easy case and he was better. Then it turned to, with many of our patients happen, is then they get upset of what happens if I didn't happen to have this conversation with you or you know enough about it to get tested. And so it made me look into this a little bit more as it pertained to different populations, but being aware of that because also things present differently on skin. And this is one of the reasons why people of color are often diagnosed with more advanced diseases than whites, because of that issue with recognizing rashes well. And again, we already just said, many people do not already show the bullseye rash. So 34% show neurological signs, probably because of the fact that, again, they're diagnosed later and why they're diagnosed outside of typical season. And you can see right here how erythema migrans bullseye rash would present and look completely different on different skin tones. So, oops, I think I went backwards. So the other thing is women. So women complaints of pain are also much more likely to be dismissed in medical care. And one of the reasons is a lot of the symptoms are nebulous by way of brain fog, forgetfulness, insomnia, anxiety, headaches, palpitations. So those can often be attributed to what I discussed before is you're just anxious. You're just, you need to relax more. You're just stressed out. And these can actually be physical complaints that don't get addressed, and is one of the reasons why many of the patients that come to see me for Lyme disease, as well as autoimmune conditions, on average, the average patient with Lyme disease sees 7 to 9 doctors before they are diagnosed. So 7 to 9. So that's a common story. So one thing to know is that there is faulty diagnostic testing. We already know the diagnostic testing is already not good for Lyme disease, and is why it's great to work with a lab like Mygenic. But what's even worse is more men than women actually test positive for Lyme. So the diagnostic testing is also better for men than it is for women. Also, hormone transitions are way more difficult for women with Lyme disease. Testosterone will also, cause issues as those drop down with the change, and changes in hormones. Particularly for women that are having menstrual cycles. Estrogen will increase up COX-2, that inflammatory response. Also, we have the release of prostaglandins, PGE2, which help with the shedding of the uterus, which is good, is what we need for a menstrual cycle. But with that shedding, with the increase of prostaglandins, it also increases our uterine contractions, which also increase up inflammation, and is why many of my women with Lyme disease will see these changes as they're going through different changes in cycle, where they're like, oh, my symptoms are worse before my cycle. I feel great when I have my period. Or sometimes I'll have women with middle schmerz in the middle of their cycle. And is one of the reasons why I also have to manage the hormonal component. You also have to manage the hormonal component for folks with autoimmune conditions. So this is something that's important to know, and look at how you're also supporting that, and not only addressing the Lyme symptoms, because the hormones and the helping to make sure that those are managed well and stable as part of the workup. Okay, so wanted to, okay, infections and autoimmunity. Just wanted to go over this quickly. So about over 80, and the connection, I'm gonna circle that back around, but how Lyme disease is related to all of this, or any infection. So over 80 condition types, I think 86 autoimmune conditions, many different reasons, genetic factors, environmental factors, hormones, which I just talked about, and past infections. So studies have shown that all autoimmune conditions are connected with at least one infection, at least one, most are two, which can initiate or exacerbate it. So there's multiple mechanisms by which an infection can trigger an autoimmune process. Most people know of what's called molecular mimicry. And what that is that these amino acid sequencing is the self antigen and the pathogen acts to actually mimic it, because it's similar in the sequencing. And there's also two other things called bystander activation and epitope spreading. So there's three, what we call molecular mimicry, bystander activation, and epitope spreading, that can happen with infections, which cause that either initiate an autoimmune condition or actually make it worse. So these are the three ways in which they show. You see molecular mimicry here, bystander activation, epitope spreading. I like to say bystander activation is more similar to what you see rheumatoid arthritis, is that like cytotoxic, that very inflammatory response. I would say similar to what we saw with COVID, with this high cytokine response, where you're like destroying everything around it. It's like a fire, like you have a fire at the house, and then all the houses catch on fire next to it. It's just this really significant inflammation. So it's very non-specific antiviral response. Self-antigens are released from that damaged tissue, and then they're presented on the antigen presenting cells. They actually allow them to present themselves to cause this autoreactive T cell issue. And then we have molecular mimicry, which I mentioned, where those antigens are structurally similar, and they cause this cross-reactive response against self and non-self antigens. And then we have what's called epitope spreading, which is from a persistent viral infection like Epstein-Barr virus, where it ensues in more tissue damage and release of new self antigens. And these self antigens are presented on these antigen presenting cells. And then the T cell response spreads to other autoreactive T cells. So you'll see that in like lupus, where it's like affecting definitely many different organ systems. So those are the three ways in which infections can actually trigger up autoimmune conditions. So Lyme disease, going back to Lyme, although Lyme is not an autoimmune condition, I often see chronic Lyme, I treat very much like an autoimmune condition, because that creates this immune dysregulation, immune dysfunction. The immune system is compromised and can lead to autoimmune conditions. So we want to manage that, because can this cause an issue later in life? And oftentimes when I'm like kind of finished, I say working with a patient with Lyme disease, I'll say there'll be three primary triggers. Hormone is one for women, stress, and then the other is when you're getting sick. Like, how are we getting your immune system to be stable as we're transitioning you off of a protocol? So many Lyme patients are also afflicted with conditions like MS and rheumatoid arthritis and Hashimoto's. I've seen patients, I had a girl recently, 12 years old, her antibodies, TPO antibodies at 400. She also had Lyme disease. We started working on Lyme disease, and guess what? Her TPO antibodies are now at 50. So there is definitely a contribution between Lyme disease and these infections and how they even relate to the antibody counts. I've seen that especially with rheumatoid arthritis, where I get those titers that actually clear or no longer show after I'm working with them with Lyme disease. So one of the reasons is that outer coat of Lyme bacteria is similar to tissue found in the nervous system as well as the immune system. And it reacts to this, like what they call leftover tissue. And this can attack the neuronal tissues as well. And this bacterial tissue that's actually not eliminated from the system, it actually confuses the immune system as a result, making it kind of like autoimmune in nature. Okay, and then other examples, so Borrelia burgdorferi, 60% of untreated patients with Lyme disease will develop arthritis that can last for several years. High titers of these antibodies can be detected, have been detected in joint fluid. And the cellular and humoral responses to this actual surface protein, which we talked about, developed in 70% of patients that have antibiotic resistant Lyme disease. And so some research has been showing Borrelia burgdorferi can trigger development of autoimmune conditions like RA, MS, or SLE in a person with a genetic predisposition. So people that have a genetic predisposition, somebody like me, I have family history, lupus, aunts have it, my mother has it, I have a positive ANA. My ANA will go up when I had COVID up to 640 and will clear as I get better. So these infections may trigger this up in the future, and is one of the reasons, again, why you want to look at all infection types and how they can relate to this, especially with somebody with a genetic predisposition. So it alters dendritic cells and interferes with the communication, which can then cause the immune system to mistakenly attack the normal cells. So this is just a quick thing on molecular mimicry, some of the other infections and what they're connected with, what type of disease conditions. For example, CMV, Coxsackie, definitely connected with type 1 diabetes. One of the reasons why they've said with COVID, too, as well, the increasing rates of type 1 diabetes has went up, as well as actually 2 in recent studies. So these are just some information to be considering in your workup. So in terms of diagnosis, now we're going to go into more laboratory tests. So IgM, you need to have 2 bands on the traditional standard by way of CDC, 5 bands for IgG. I wanted to mention that because I've heard people say that incorrect, where they've said a patient has to have 5 bands at least when it's related to IgM, which is not true. 56%. So 56% test negative, which is huge. So many of the patients that you test will actually test negative. And they might be positive. Western blot, again, is more accurate. It usually can range. So IgM is typically within 30 days, up to 4 months. I've seen people have had it longer, showing for a longer period of time with IgM, IgG after 4 months, and as early as 2 to 3 months. And then you can have obviously both bands. So this is a slide here of by Mygenic on the diversity of tick-borne, diseases and the pathogens in this 2018 study that they did of the samples of over 10,000 patients in almost every state in the country. 37% were positive for Babesia, 32% for Lyme, 27% for tick-borne relapsing fever, 19% for Bartonella, 16% for Anaplasma, 12% for Rocky Mountain, and about 7% for Ehrlichia. And you look at this, many people, most ticks carry more than one tick-borne infection. They'll often carry 2. So 40% actually tested positive for 2 pathogens. So important to know, because these numbers are really striking of the rates of positivity. And most Lyme tests detect only, when you look at some of the primary conventional lab vendors, they only detect for a single either Borrelia species, which is Borrelia burgdorferi B31. A negative test may simply be due to testing for the actual wrong species. So a common 2-tier test misses many patients because they actually don't look for many different species types, which Mygenic does. And we're going to show that. So Mygenic actually suggests a panel approach would test for all tick-borne diseases using a variety of both direct as well as indirect test methods. So the direct testing Well, the indirect testing, which is done by most conventional labs, is testing just for antibodies to the bacteria or parasite. And so that's through Western blot, immunoblot, immunofluorescence, IFA, and IgX spot test. And the direct tests would be PCR, DNA, real-time fish testing, which I often see for Babesia as well as Bartonella, and then culture. So they do a mix of both. So it's important to understand the immune response when prescribing tests. So one of the things to know is I often would have patients that came in and they said, I got bit by a tick, I have a bullseye rash, and in conventional treatment, they went to urgent care or ER, they would often give them prophylactic doxycycline for 10 or 14 days. And they may or may not retest. And ideally, you definitely want it for a longer period of time because of their replication cycle. However, oftentimes when you do those antibody tests like a Lyme Western blot, I'll tell patients it might not test positive for at least 4 weeks, oftentimes 6 weeks. So what do we do from there? What do we do for treatment? We're not 100% sure. Do we treat them prophylactically, et cetera? And so what's great about Mygenic is they have a very particular test early after the infection, which is measuring the T cell response. And that's when the T cell response is the highest after the infection. So it makes they make what's called the IgX spot, which is the most effective test because IgM and IgG antibodies, like I mentioned, develop soon after, at which time the Western blot and immunoblot tests are more effective. But initially after, when we think someone might be positive, that IgX spot test is great. Something I've looked at for our patients, and then the T cells also reappear later. But it's a good thing to consider, especially based on what you're hearing from patients, especially as we're going into the summertime. So if you look at the testing Mygenic provides, they have multiple tests for each major, basically tick-borne disease. We have for Lyme disease, multiple species, immunoblots, the spot test, which I mentioned, Western blot, IFA, PCR, LDA, BCA. For tick-borne relapsing fever, we have both the immunoblots, PCR and BCA. Bartonella, we have that, plus we have the fish test, which is something you often want to look at, fish test for accuracy with Bartonella as well as Babesia. Rickettsia, we have the PCR and IFA test, as well as that for Ehrlichia and Anaplasma. So one of the things is a key differentiator for Mygenic is their Lyme immunoblot, which was launched in 2017, which is considered the gold standard in Lyme testing. So if you look at this, I had mentioned B31 in the standard test is what they're testing for, which often can show false negative. And if you look here, this is testing for many different species. So we have Borrelia burgdorferi 297, we have Californis, we have Mayoni, we have Fzella, which I mentioned is very common in Europe, and Guaranay, Spilmani, as well as I'm botching the names, Valesiana. So it's testing for 8 species of Borrelia as opposed to 1. It helps to replace the Western blot. It's way more accurate. The sensitivity is greater than 93%, whereas the ELISA and Western blot 2-tier recommended by CDC is only sensitive by way of 57%. So hugely different, over 30-something% higher by way of sensitivity level. Immunoblot uses pure, specifically created recombinant proteins for the test antigens, which we show here. These recombinant proteins are created. A very precise amount is sprayed actually directly on those specific locations. Because the quantity and location are controlled, because of that is way more consistent and also more accurate. And also the bands, the positive bands are more clearly displayed. And when you look at this here, there were 43 samples that were collected on positive on Lyme immunoblots. And you see B31, B297, all the ones that I mentioned earlier. When you only do Borrelia burgdorferi B31, when they did the study, Western blot was performed. Only 14 of the 43 Lyme immunoblot positive samples were Western blot positive. So it missed 29 of the 43. However, when all 8 Western blots and all these species were added, were performed, the remaining 29 samples were now detected. So very important, we look at these different species types. All 43 in the samples were positive. 68% of the patients would have been misdiagnosed. So 68% would have been misdiagnosed without the immunoblots. So the other things is just a copy of an example report, patients positive for Lyme IgM by both Mygenic as well as CDC criteria, meeting both of those standards here. This is also, again, the spot test detects the T cell response. So the sensitivity level is 32% by IgX, positive by IgX. Spot tests and immunoblots would normally be by the spot only 17%. So the rate is much higher by way of specificity level. And this is actually really helpful to know that spot tests, when it's useful, it's very useful when a erythema migrans rash, the bullseye rash, is not present or someone does not recall it. When the Borrelia, again, is early on in the early stage of infection, when there's a subgroup of Lyme patients that lack detectable Borrelia-specific antibodies, and when it might be under a detectable level because antibiotic treatment has been recommended. So they may have been on antibiotics and it would make that antibody count actually lower. So again, test the T cell response, more sensitive. One of the disadvantages, it cannot be offered as a standalone test for Lyme because when Lyme specific antibodies are present, the test can be negative. So you need to do both. And unlike PCR serological tests, T cell tests have to be performed on blood collected within 48 hours. So let's talk about tick-borne relapsing fever. Mygenic test for multiple species of that. So it's testing for Myiomate, and all these 1, 2, 3, 4, 5, 6. Most of the tests are only looking at Borrelia myomote for the relapsing fever. So it's checking for, again, more species types. The sensitivity is 73.8%, and the specificity of that is 97%. And this is just a graphic of where that's presenting throughout the country. Again, all different states in the United States. So some of the co-infections to know, we have both the direct and indirect test for Babesia. I mentioned the fish test is one that we look at, as well as the PCR test, which is going to check for microti, as well as Duncani for Babesia with a specificity of greater than 99%, and also including the IF immunofluorescent test for IgG and IgM, in addition to the Western blot, which we also do. Other multi-species, this is for Bartonella, Lyme, and TBRF immunoblots have both sensitivity and specificity at a very high level because it is testing, again, for multiple species. When you look at Bartonella immunoblot IgM and IgG, it's tested for 22 Bartonella specific recombinant antigens, and 2 controls are present on every strip. And if you look at on the bottom here, Bartonella genus positive simples will be speciated to the following 4 species types. So things like Cancella, Quintana, all of these are included in the test. Why this came out in a crazy small font when I'm showing here, I have no idea. I just wanted to mention it was not like that on my side, but I think because I changed the presenter settings, it changed it a little bit. But some of the other markers when I'm checking through regular conventional labs, HSC, ECRP, CRP, I just wanted to go back to mention other labs. Early antigen is something I'm testing for, EBV, EBNA, IgM, and IgG. I'm also looking especially for on their hormones, which I mentioned, and their cortisol testing, because those can be affected. And also I often will look at other exposures, mold exposure, because sometimes that can be an overlap when a patient has, so I'll do mycotoxin testing, which Rupa Health has access to in terms of lab vendors for that, to make sure that that's also not in the picture for patients. as well as other allergens. I'll see when there's a change in season for some of my patients with Lyme disease with histamine going up. Histamine is an excitatory neurotransmitter, so it can cause anxiety for some of my patients or brain fog, et cetera, and that can overlap with the case for Lyme. So if you see there's some seasonality to it, you also want to test for mold or environmental allergies as well as food allergens. So really, again, dependent on the depiction of the case. So I'm at 45 minutes, but I'm going to try to move as fast as I can because I want to make sure we have enough time for Q&A. I just want to mention some
your
of the
time. No worries, no rush.
Okay, I'm not speaking too fast, right? I hope
No,
not.
you're going perfect. I speak fast too, so maybe
Cadence.
yeah, maybe my barrier to hear all that is a little bit different, but I think you're doing great. Keep going.
Okay, great. You guys can give me feedback on that if so, or I'm more than happy to go back to some sections if not, because I had so much I wanted to make sure I had a chance to. So some of the treatments I do integrative wise, and some first I like to go through conventional. Typically, if you go to a Lyme literate doctor, which you can find through, oftentimes many of them are iLabs member, and I'm glad Dr. Barascano is going to be or is here to also share, but they will often alter different antibiotics treatment. The most common one we know of is doxycycline. If a kid is under 8 years old, they're often not doing doxycycline because of the staining of the teeth. They can do amoxicillin, azithromycin, tetracycline. I've seen rifampin, dapsone, like tons of different even antimalarials, depending on the person and what they're presenting with. These are some other treatments by way of medication that might be considered for someone with antibiotic treatment or antivirals. Now, in terms of integrative medicine, these are some of the things I mentioned. Baseline immune support is huge, especially for someone that has had Lyme disease for a long period of time, because there's definitely some immune dysregulation and dysfunction. So vitamin D, as everyone has been talking about like crazy, especially in the last couple of years, actually expresses itself on many cells within the body, the B cells, T cells, and antigen presenting cells I talked about earlier with immune dysfunction. It suppresses the T cell proliferation and also shifts from Th1 to Th2. It's important that those both are in balance, which can cause or decreases production of those anti-inflammatory cytokines, which is important. And tons of studies have shown vitamin D deficiency is connected with increased progression of autoimmune conditions for RA, SLE, and mixed connective tissue disorder. Vitamin A is also another one to look at, cellular immune response and humoral immune response. I'm often testing that in labs. Vitamin A and zinc levels as those work together. L-leucine might be something I look at, especially with someone with EBV. You have to be careful of doing it too long because it does block the activity of arginine. And monolaurin is another one that has been heavily studied, tons of research, which I have cited here, for things like HSV, CMV, Mycobacterium, Strep, Campylobacter jejuni, as well as EBV. Again, why the font is crazy small, I have no idea what happened here. These are some of the other herbs that have been heavily studied: Artemisia, oregano oil, andrographis is another one. Turmeric, which actually not only helps with decreasing inflammation, both the LOX and COX pathway, but it inhibits interleukin-1, inhibits interleukin-6, has been studied to work against babesia, has been studied also for microbiota diversity, especially if someone is on antibiotics. You want to make sure that you're supporting them. And many of the antibiotics are yeast forming. So you want to look at things like Saccharomyces and things that are supporting yeast, things like oregano or some kind of antifungal. And also improves cognitive function. Depression has been shown, and anxiety and mental health issues to increase up inflammatory markers like interleukin-1 and 6. So I've also even used turmeric for people high dose for depression. Cat's claw, which is Eukarya tomatosa, has been shown and studied for all the different, many of the different Lyme disease, tick-borne infections like Borrelia, Babesia, Bartonella, Rocky Mountain spotted fever, as well as autoimmune conditions. Some other support, golden seal might be something I look at due to the berberine activities, antimicrobial support, and gut support. I will often use this also for my kids with, strep or any, issues, GI issues that I will test for. Serrapeptidase, so Lyme produces a lot of biofilm, and what biofilm does, it's used as a shield against antibodies and immune system. So you need to put patients on things that are going to help with biofilm. Now, this could be even if they're just on antibiotics. If someone is just on antibiotics, I'm often doing things like serrapeptidase, et cetera, to help to increase the effectiveness of those things. And it helps the body break down protein to decrease inflammation and mucus. Oregano, which I mentioned, as an antimicrobial, antiviral, and antifungal. Magnesium is responsible for over 300 biochemical reactions in the body. Might be something I support, especially different forms like glycinate for someone with anxiety, or taurate for a patient that's having palpitations or symptoms of more cardiac issues. Ginkgo is another one that also helps with which I put people on for brain fog, helping with lymphatics, clearing of the brain, and also increasing concentration, which commonly happens. So those are some of my go-tos. There's way more I do in practice by way of integrated treatment, but I know today I was focusing more on the labs, diagnosing for Lyme disease, and the labs, and for integrative treatments. I wanted to just discuss really briefly, but not go into a deep dive for it. So I thank you, everyone. I want to be open to Q&A. I just came out with kind of an early launch of my book called Women in Lyme, where I go into a way deeper dive for folks that are interested in hormones, et cetera. So you can, to get updated, I just went to Lyme Bites conference in Mohegan Sun this past weekend. I did a pre-launch of the book, but definitely go into womenandlyme.com so you can get updated on that as it comes out June, July. My practice is Fairfield Family Health, pretty active on Instagram, my naturopathic.physician account. So please feel free to follow that so we can stay in touch. Or if you have any questions at all, I'm often presenting on this topic. And I'm glad to be able to be here for this time. And now we're open to Q&A. I want to make sure also Dr. Birascano is here to be able to support that as we are answering questions. So thank you, everyone. Please connect. I always love to connect with doctors and give any insight or support as I can.
Absolutely. Thank you so much, Dr. Patterson. I am attempting to add Dr. Birascano on here, so hopefully they can get that invite to join as a panelist. But we can go ahead and just start asking some questions, not maybe directly related to Mygenic, if that's okay.
Okay, yeah, of course.
Cool. So we're just going to go chronologically, y'all. If you do have any questions, write them in the Q&A button. We'll try to get through as many as possible. There's a ton of questions. So the first question we have is, do you see or treat anaplasma?
Yes, I definitely have many patients with anaplasma, Ehrlichia. The treatments honestly are pretty similar to how I treat people with Lyme disease. I'll see sometimes with anaplasma, there's more edema, fluid, et cetera. I also I feel like every infection I had, every tick-borne infection I had, but it presents really similarly. It's definitely in my panel of things that I check for.
Okay, perfect. If a bullseye rash is noted, can it be assumed to be a tick-borne disease?
I would likely definitely assume, because that is a unique presentation for Lyme disease. I love actually when I get someone that has a bullseye rash, because I'm like, it makes it way easier, and I will treat them. There's a formula I use called like Afterbite formula, Chesney formula, that actually has a lot of a combination of herbs. I'll initially begin them on, and then I might just test them. I might do the immunoblot 4 or 6 weeks later, because I'm assuming that they actually have it. I might not do that acute test.
Perfect. Do symptoms worsen with pregnancy and lactation?
I've seen both. I've seen the same for autoimmune conditions, where some of my patients are way better when they're pregnant. And I've seen people definitely get worse, because again, we have that hormone change. I've seen the same with many different infection types. So that is one of the challenges in terms of treating when someone is obviously pregnant. One of the things we do in our office for folks to look into if they're interested is something called low-dose immunotherapy with Dr. Ty Vinson. There's only a couple hundred practitioners trained. I feel safe doing that with, women that are pregnant. It's a little harder when you deal with herbs, et cetera, when someone is pregnant, but I definitely have seen both. Hormonal changes can definitely make it worse. I'd say the ones that seem to get the most impacted is women that are menopausal, perimenopausal, because of that drop down in testosterone and estrogen, that big change. So that's oftentimes where I'm seeing the biggest shift is at that time in terms of most notable symptoms hormonally.
Yeah, makes sense. Is there a roadmap on whether to address virus first or bacteria first when both are flaring?
That's a really good question. And does come up to me is like, what happens if the person has 5 infections? How do I know which one to handle first? I oftentimes, this is where like in our training as naturopathic doctors, we get to like, what's the root cause, why, when did it start? This is where that history taking is really helpful. If someone says, I got the bullseye and rash like 2 years ago and everything went downhill since then I'm like, okay, this is probably the Lyme disease, and I'm going to really address that. But if someone has been like, since I was like, since I've been 12 years old, or after I had mono when I was 18 years old, it feels like ever since then I haven't been good. And then I got a tick-borne infection and aggravated it. I'm probably going to be focusing more on the EBV, and then adding in layers of Lyme. But sometimes you could be surprised at what is the thing that is concerning them more. Like I've had a patient that we thought it was Lyme disease. She had really significant neck pain, enlarged lymph nodes, but mostly neck pain. And she said she thought it was Lyme disease. We checked, EBV was positive. I did work with her for Lyme, but it seemed like things weren't sticking. And it wasn't until I addressed the EBV that was like the thing that fixed it the most for her. So even though she presented with more joint physical pain, which would seem more Lyme, it was actually the EBV that helped. So sometimes you have to kind of play around with it, but this is where like the history taking is really helpful to kind of know when the pieces began and when they didn't.
Perfect. So the next question is, diagnosing Lyme is one thing, but once you initiate treatment, how do you confirm that treatment was successful and you can stop? And there's a second part to that, but I'll let you, or I guess
so everybody kind of does it differently. I do know some docs that check frequently, like every month or 6 weeks. I honestly don't think that is necessary, because sometimes it could be disappointing because people's numbers don't go down fast enough. And then it could be expensive too, right? So I typically tell my patients that I want to see symptomatic improvement within, usually I say 15 to 20% within like 4 to 6 weeks, but we're building their protocol. But I want to see them in some like movement, at least at minimum 3 months, like 3 to 6 months. Now it depends on how long they've actually had it for. If it's been, 10, 20 years, that might take longer, but I rarely not see a change within that time frame. So what I do is I'll typically retest again about 6 to 7 months later. And I'd say about 90% of my patients, there will be a shift in terms of improvement in those numbers. But really, again, Lyme disease is a clinical diagnosis. So if all of their symptoms have improved, that's the biggest thing. And you really want to do either a questionnaire or really good history taking so you can see where those changes are. Because lots of times people forget. Like I'll have a patient that'll say, like, oh, one of the common symptoms, like when I get up in the morning, I feel like I'm walking like, I'm showing my age, but like Frankenstein, like kind of like I can't feel my body, or I have like numbness or tingling in the feet. And I'll ask them like third visit and they're like, oh, I forgot about that. So unless I go back sometimes to prompt them, or, oh, I had a headache every day, now I'm having a headache twice a month, they may or may not remember. So I go through. Sometimes, honestly, I'll have people that'll test positive for infections that they didn't test positive for before. So to me, that often means that it's not necessarily new. It's just that it didn't show positive before, especially for some of those co-infections like Bartonella, Babesia, et cetera. So I will retest around 6 months. Some people do it sooner. But what we're looking at is the clinical symptom changes. And then somebody said, how about CD57? Yes, some people do that for sure. Sometimes you can check the complements, complement 4, complement 3, et cetera, in terms of checking for it. All the inflammatory markers, those are definitely good things to check too. I'm always trying to balance that out with cost too, but those are definitely good ones to also look at, CD57 for Lyme for sure.
Perfect. What about SOT therapy?
That is, SOTs, it gets pretty pricey, to be honest. So it's one of those things some of my patients will do, after they've done like IV antibiotics, they might then do SOT, but it's thousands. And so I get a little bit concerned about cost. I have seen some people do really well with it. I've seen with IVIG is another one. And I've seen some totally neutral or no response. So to me, that's one of those like kind of last leader things I do, or I will look at. So it's expensive.
Absolutely. And we are at the hour, just so you know. We can keep going with questions. Dr. Patterson, how much time do you have? We have a few more.
I could still have till 10 after. So. Okay,
perfect. So let's keep going. And just to reiterate, for those of y'all who do have to jump, first and foremost, thank you so much for joining us this morning or afternoon, wherever you're located around the world. We appreciate you joining us here for this Lyme 101 presentation. This presentation is being recorded, and we'll go ahead and send it out along with the slides. I know you're getting a lot of requests for the slides. Don't worry, we'll get those all in your hands once you have the chance to do some edits to the video. So stay tuned for that. We will send those out via email. And of course, you can have access to those on rupauniversity.com as well as through rupahealth.com. So the next question is, what herbs can be given to children with Lyme?
So I actually do, am I allowed to say names of companies? I'm like never sure with these things.
Sure.
Because not see. So I actually use Nutrimedics. A lot of people like Beyond Balance too, because they're glycerite. But Nutrimedics is an alcohol base, but it barely, I barely taste. I never had kids complain about it. So I do the dosage, but I do it in a much smaller amount. So like for adults, I might do, let's say 15. And then for like kids, I might do 5. The cool thing, what I love with kids is they tend to respond a lot faster. Like I've had one kid, I think we did like literally a week and the kid had no symptoms, which is crazy. So I will do that. So I definitely Nutrimedics, the Beyond Balance has a glycerate formula. So I usually do that. Some looking at some other questions I want to make sure to answer, but yes, I definitely see about 30, just so you know, 38% of our practice. I'm a numbers person. I'm a business person. So 38% is actually kids and about a third of our practice are males. I will be honest, I feel like the males, the drops take them out a lot faster. Why? I have no idea, but it's very dependent on the person. So like I have a cop that's on 3 drops of Cowden and when I go up 1 drop, he herxes and he's fine with 3 drops. And then I'll have a kid or like a person that's 100 pounds on 15 drops. So that's the interesting thing with Lyme treatments is like, it literally can depend on the person, is why you can't really come into it thinking it's one thing for everybody all the time too.
Absolutely. Well, let's do something that I've never done during Q&A. You mentioned that there's some questions that you want to make sure get answered. Do you want to
see a question? Yeah, see a question. This has always been my own personal challenge. So like low income country, what possible development lab testing, how to help. I mean, and somebody that can't afford it or testing is an issue. I do see a question about Mygenics with insurance coverage. I do know I had the fortune of meeting with the CEO a couple weeks ago, so I can make sure I was covering everything. And they do have a way to submit where they'll submit the super bill. And they did say a good portion of people do get reimbursement. There are some other labs that can also do it that are a little bit higher by way of their quality assay. You guys can feel free to email me because I don't want to talk about too many different companies to let you know, which I put in the chat box. And then Vibrant, I know there was a question on that. Honestly, I don't use them. So I feel like I can't speak too much to the differences in the labs, to be honest, but definitely more than happy to investigate that myself as well.
Yeah, and I can honestly expand a little bit as well on just the lower income, patient base that you're trying to serve. With these functional medicine tests, they can be very expensive, right? And with Rupa, the platform that I'm representing here, and the people that are putting this presentation on, we actually offer multiple different payment solutions to patients. So we can accept not only just cash or credit, but we can also accept HSA, FSA, and we can even set up 3-month interest-free payment plans with the patients to allow them to pay for the tests. So the idea here is to just make these tests as accessible as possible to everybody. Were there any other questions that really caught your mind before we hop off?
No, those were some of them. Yeah, children, blah, blah. I've even seen them used for animals. I've used it for my dog who kept trying to interrupt during the session. Hopefully you guys couldn't tell that much. She literally is 100 pounds of like muscle. But anyway, so people have used it for that too. I'm trying to think of other things. Sometimes if I'm not sure, and I'll go by the symptoms, they can't afford testing, I'll try for like a small amount of a dosage and see how people respond. I've had kids we've had to do it for that the parents are 100% sure they have it. We have all the symptom makeup, but they're scared of doing blood tests or blood draws, et cetera, where we put them on a plan. But definitely there's many different ways to I guess, get around trying to get with treatment. So yeah, I think that's it. I think someone asked also about Dr. Horowitz. I actually trained with Dr. Horowitz. So for folks to know, Dr. Horowitz does have a training academy that he started. I was one of the first cohorts. So he does do the dapsone, and rifampin. Rifampin's pretty strong. So a lot of my patients herx a lot when they're on it. I have had some people that have had great results from it. It's just that those are heavy duty things. So you need to make sure you're supporting them. The biggest challenge with integrative provide, I think, is like supporting them off of antibiotics. And so what I see sometimes is their immune system needs to be built up more when they get off of it, or else they do what? They herx and they feel like crap. And so lots of times I'm making sure there's like a really strong transition instead of just stopping them cold turkey, because now their body, it's just like I say with steroids, like you get steroids, your body stops producing enough and it doesn't know what to do. There's like a crash. So I put those patients on adrenal cortex and all these adrenal support before they cut off of it. So the same thing with antibiotics, if you're constantly pulling and having this help, when you get off of it, your body is like, what am I supposed to do? So I'm usually putting them on like high dose immune support as they transition. So there's less of that drop off, but it does work well for those people that have stubborn infections. It's just like things like rifampin are pretty strong.
That's awesome. We appreciate the information so much, Dr. Patterson. So much engagement. Unfortunately, we can't get to everybody's questions. Otherwise, we might be here for another hour. But any final thoughts?
No, I think I would love to, if folks have any questions, feel free to email me. I definitely, other things that could present on. And I really loved infections and autoimmunity. That's something I addressed a lot, which I did a teeny amount on, and what to look for. But yeah, it can mimic, a lot of people are saying mimicking other conditions. Definitely check stool samples if that goes down that route. And also not looking at everything like it's Lyme disease. I've seen that too, where people, everything is that, but just making sure that whenever you're approaching a case, you always stay open to all of the like what ifs basically. Yeah. So I think that's it, but definitely feel free to reach out. I try to get through as much as I can. I really appreciate the engagement and thank you for the nice comments as well. And, but definitely connect in whatever that way may be.
That's amazing. Dr. Patterson, this was amazing. Thank you so much. Everybody go follow her on her socials. She shared the email out inside the chat. So if you have any questions, reach out, as well as reach out to me if you have any questions. So you're welcome to hop off, but thank you again so much for your time. What I'm going to do now, for those of y'all who are able to stick around, first and foremost, thank you so much for sticking around. What I'm going to do is I'm just going to do a quick transition and show you how to order these tests directly from Rupa Health. So for those of you who are new and don't necessarily know who I am or even what Rupa Health is, I want to talk to you a little bit about Rupa Health, who we are, what we do, why are we hosting, these sessions on a weekly basis on Lyme and partnering with these different labs. Well, Rupa Health is a functional medicine platform designed to make it easier when it comes to lab testing. So when you think about the traditional practitioner within the functional medicine space, most practitioners work with anywhere from 6 to 8 to even more different labs at any given time, right? Within the process of even just setting up 6 to 10 accounts with labs, right? That kind of even sounds like a headache, let alone managing all those different logins, to place your orders, to manage your results, all that, right? So what we've done is we've created a platform that's aggregated over 25 different labs, including Mygenics, in one place. So now as a practitioner, you just need one login with Rupa Health, and you have access to 25 plus, soon to be 30 different labs, like I said, including Mygenics. And so you just have one login, you can order from over 3,000 tests in one place. Additionally, beyond that, you can also track and manage all your results. We also have EHR integration, so those results potentially can be just integrated and sent directly to the EHR that you're using, right? If not, you can just track all of those results directly within your Rupa Health account. Again, the idea here is just one single source of truth. You order everything in one place, you get all your results in one place, you can send them to the patient, you can request a clinical consultation, and you can even view that requisition straight away. What I'm going to do is just show you really how simple Rupa is to use. Of course, I'll talk about how it costs and how the costs break down, but let's chat. So to start an order is simple. We just need the patient's first name, last name, and email address. We collect everything else directly from the patients. So if you don't have the patient's information handy, their shipping information, their demographic information, right? No worries, we collect that right from the patient. Once you're within the order screen, it breaks down into 3 different sections. Up at the top, you can create custom bundles. So if you want to create a Lyme bundle that's composed of the tests that Dr. Patterson talked about today, it's just one click, and all of those tests will be added right into your account without having to go to search through each individual portal to do so. Below that, you have access to be able to create a favorites list. So putting a little heart next to individual tests that you're commonly ordering, you're able to order from, like I said, 25 plus different labs in a matter of seconds. So if I want to order the Immunoblot and I want to order the Lyme IgX spot, right, straight away. But let's say maybe I also want to order a GI map from Diagnostic Solutions. I can go ahead and order that as well. right? So super simple. Once those are in my cart, it's as simple as pressing send order to patient. And that's how really easy it is to place an order on Rupa Health. What I'll show you next, though, is how customizable we can get with these orders. So for example, I know one of the questions in the chat earlier was, hey, how often do you retest? Right? With Rupa Health, we can actually schedule these orders out in advance. So if I want to retest a patient 6 weeks down the line, all I have to do is schedule that order out and it'll automatically send that order directly to the patient. The prices themselves, well, we offer the same prices that you would get as a practitioner if you were to be working directly with the labs. So we offer the same wholesale practitioner rate that you would be getting working directly with the labs. The way that we generate our revenue is simple. We charge a we charge a 7% processing and ordering fee on each order. And this is paid for by whoever's paying for the tests. What I mean by that is that if you're having us manage billing directly with the patient, then the patient in this case will pay that 7%, aka $36. Rupa, in effect, is free for you. There's no additional cost to use Rupa. There's no sign-up cost. There's no subscription. There's no minimum cost or fee or payment, anything like that. This 7% that you're seeing here is the only way that we generate our revenue here at Rupa. So if you're having us bill the patient, then you'll never pay anything to Rupa. Of course, you do have the option of paying for the test yourself. You'll simply click that box. You can add your payment information in here, save it, so you don't have to type it in every single time. From there, you can add notes for the patient. This can be anything you want the patient to know. You can even save templates, so you're not rewriting the same instructions over and over. You can add notes for Rupa. This can be anything you want us to know. And as well as you can add ICD-10 codes. I know that Dr. Patterson mentioned this earlier. We can actually assist with the creation of super bills for your patients. So if you know that your patients want to submit a super bill to insurance for potential reimbursement, we can actually assist with that as well. So you just hop in here. You can add ICD-10 codes. You can even just search by keyword, right? So we have a whole catalog built in here. You just add that keyword, and what will happen in this case is once you send that order to your patient, we'll go ahead and send the patient a template walking them through how to create that super bill and how to submit that to their insurance, again, for potential reimbursements. We never want to make any promises when it comes to reimbursements, especially when it comes to insurance, but we can make this process easier for you and your patient, and you don't even have to be involved, right? From there, it's as simple as clicking send order to patient. Now, a big question that I'm sure y'all have is, what does it look like once you send that order through? Let's chat about it. The patient experience is another pillar to Rupa Health, right? You have the practitioner side, the operations side, but we want to make things easier for everybody. So what is the patient experience once you send it through? Well, Rupa's created a process that you don't even have to be involved in. So we want to make this process. You come to Rupa, place your order for your labs. We take care of everything in between, and then simply you get the results as they come in. Here's the timeline. Once you place that order, your patient will receive an email from us. We'll notify the patient once the order has been shipped. We'll send out instructions, FAQs, and a lot of our tests now even have videos on how to take the tests. We'll manage any patient support questions that they have. Additionally, we'll even manage any specimen issues, which is pretty cool, right? All these things that would ultimately take time out of your day and your staff's day, we'll take care of that for you. We'll check in with the patient, and then ultimately you are notified as a practitioner when the results are in. So here is what the patient will see. Once you place that order, the patient will receive an email that looks very similar to this. Hi, Joshua, Dr. Jordan has ordered these tests for you. We will introduce who we are, and then we'll actually highlight the different payment options that we accept. So I mentioned this during the Q&A earlier, but Rupa accepts multiple different payment solutions. So not only can we accept cash or credit, we can accept HSA, we can accept FSA, and we can even set up a 3-month interest-free payment plan with the patients. Right? This is huge. We'll send the kits out after the very first installment. This is one of the ways that we're lowering the barrier to get access to these oftentimes and sometimes very expensive tests. Over here, we'll collect all the necessary patient information to complete the order. We'll highlight the tests that were ordered. And then from there, we'll collect all the necessary information to send the order to the patient. From there, we'll notify when shipping has been sent out, and we will send an email following a couple of days that looks similar to this. So we'll outline instructions for each of the kits. You'll notice the instruction example over here on the right-hand side. So they're very comprehensive, but more importantly, they're very user-friendly, right? They're written by somebody on our team. They're real humans, and so they're intended to be very user-friendly. But like I mentioned before, if the patient has any questions in regards to the test, they just reach out to our team, and we will facilitate the answering of those questions on your behalf. From there, we'll walk the patient through how to fill out the requisition form. And additionally, beyond that, we will even help coordinate phlebotomy. So we can do this in a couple of ways. We can either customize the instructions based on your recommendation. So if you yourself can draw blood or you have somebody that you want to recommend, we can take that information and send that to the patient. Otherwise, what will happen is we will go ahead and send the recommended options based on the lab that the patient is working with. But let's say that the patient wants a mobile phlebotomist. They want somebody to come view them or come draw the blood at their house. We can help coordinate that. We'll search by zip code. We have a full database that we've vetted out, and we'll go ahead and send those options directly to the patient. From there, we'll follow up with the patient, see if they have any questions, and then ultimately you're notified as the results come in. Once those results are in, you're able to just hop right into Rupa Health, and you can view all those results straight away, like I showed you before. And if you're working with currently Practice Better, Elation, or Optimantra, we will be able to send those results directly into your EHR, but keep an eye out for some really cool upcoming partnerships with additional EHRs in the near future. So with that, that's kind of the core of Rupa Health, the two pillars, but I really want to just quickly show you the third pillar of Rupa Health, right? We have the patient experience, we have the practitioner experience. Let's talk about education. Education is a core component within functional medicine. There is so much information out there, right? Where do you even start? Rupa wants to be the place where you start. So when you're coming out, whether you're a new practitioner or you've been in practice for 25 years, right, we want to provide you with additional education on all of the labs that we work with. So you actually are all part of Rupa University right now, attending one of our free live classes. Again, we're recording this and we're going to upload it once we've had the opportunity to do some edits to it. But you're able to join these classes every Wednesday. Traditionally, they're going to be at 11 o'clock. This one was adjusted a little bit, or 2 o'clock Eastern time. You're able to join them, and we'll always upload them and record them to this library here. And you can see upcoming class we have is Discovering the Immune Reaction to Food, both Sensitivities and Allergies, with Dr. James Lavelle, coming up next week. So you're able to sign up for these for free and watch them. Additionally, beyond free classes, we even have paid courses such as boot camps. So you're able to hop in here and join a live boot camp. The one we have coming up with Dr. Carrie Jones is connecting the dots on female hormones from PMS to PCOS using the Dutch test. This is a 6-week course where you're able to join in. You even get a free Dutch test to use on yourself to go over and review during the boot camp. So beyond just a place where you can come and place all your orders, Rupa wants to be a place that can help provide you continuing education and beyond when it comes to functional medicine. Now, last thing I want to call out is just Rupa Health, how you sign up. You just go to rupahealth.com. Signing up is free. You do need to be a licensed practitioner at this time. That should change, honestly, in the next couple months here. So keep an eye out. Don't want to give too much information away, but we do have a program that's going to come out to make it easier for practitioners whose licenses may be limiting to be able to order from Rupa Health. That said, you do need to be a licensed practitioner within 47 of the 50 states. Unfortunately, right now, we cannot operate in New York, New Jersey, or Rhode Island. So keep that aware. And it's more of just a legality around shipping labs directly to those states. So with that, y'all, my name is Adrian Martinez. I'm going to share my information up here. I'm the head of practitioner partnerships here at Rupa Health. So if you do have any questions or want to set up an account or just want to set up some time to talk about how Rupa might help within your clinic, I'm more than happy to do so. I appreciate you so much for joining and sticking around this whole time. Have a great rest of your Wednesday, and we'll talk soon.